In this podcast from Chapter 20, Musculoskeletal Injuries, we can look at the signs and symptoms of common musculoskeletal injuries. Now, it's best if you just relate the structures of the musculoskeletal system to the name of the particular injury, and then you can anticipate what the signs and symptoms might be. For example, a sprain, which we know is an injury to a ligament. You can expect swelling and bruising, but because ligaments join bone to bone, you can expect joint instability as well, maybe abnormal motion or a greater range of motion than is to be expected. Decreased motion is possible as well because of the pain and the swelling that can occur, and especially difficulty with bearing weight. For a strain, which we know is an injury to a muscle, pain is expected when using the injured muscle for flexion or extension. You may see swelling or bruising with that muscle as well. A tendon injury, a rupture, is going to result in a gap under the skin. This is the hallmark sign where the tendon, which joins muscle to bone, has been ruptured, where that connection has been interrupted. We're going to end up with a little bit of a gap right there. Because there's minimal nerve involvement, the pain may be minimal after the initial injury, and we can expect little bruising or swelling. For a fracture, you can imagine that disrupting the bone, injury to the bone, is going to result in pain and tenderness. We might have bruising and decreased motion, but you can also expect deformity or, in some cases, bone crepitus, that crunch as fractured bone ends rub together. I think the best way to remember these signs and symptoms is to think about the structures, to think about the function of those structures, and then you can expect what some of the signs and symptoms of musculoskeletal injuries could be.